Welcome to the 8th session in the Systematic Review Seminar Series. My name is Tom Harrod, and I'm the Associate Director for Reference Instruction and Access at the Himmelfarb Health Sciences Library at the George Washington University. The topic of this session will be performing quality assessment of included articles, a step that is included in many, but not all, published systematic reviews. On this slide, you can also see where we are within the seminar series. Here's an outline of what we'll be covering in this session. We'll start by discussing what is meant by risk of bias. Then we'll look at different tools that are used to measure risk of bias, as well as some of the ways that risk of bias is reported in published systematic reviews. Published systematic reviews often include a quality assessment of the articles that have made it through the 2 screening steps. The intention is to analyze included articles for the possibility of bias which might diminish the weight that is given to the results in a particular study. Here we see a definition of what is meant by risk of bias: systematic error of deviation from the truth. To be clear, when analyzing for bias, we aren't directly measuring bias, but trying to determine from the methods used by the authors whether or not the conditions for bias exist. It's also important to note that the success of this analysis is highly dependent on what the article authors report in their methods section. If the authors neglect to include critical information, it may not be possible to do a thorough or accurate risk of bias assessment. You will often see this represented when systematic review authors report the results of their risk of bias assessment. So let's dive in and look at one very common risk of bias tool, the Cochrane Risk of Bias 2, or ROB2 tool, which measures the likelihood of bias in published randomized controlled trials. The ROB2 tool works by asking a series of questions to determine the chance of bias across a number of domains. You can see those domains listed here on this slide: random sequence generation, allocation concealment, blinding of participants and personnel, and blinding of outcome assessment, among others. Again, to reiterate, this tool is used by systematic reviewers to evaluate randomized controlled trials that they are including during the data extraction phase of their systematic review project. The result of this evaluation will then be reported in the final manuscript. Here's a closer look at the type of question that guides the analysis for a particular domain, in this case, random number generation. The person performing the systematic review will read through the methods section of the randomized controlled trial that they are analyzing to determine what procedure they used in the domain, and then, based on the guidance provided for the ROB2 tool, use that information to decide if there is a high or low risk of bias for that article in that domain. On this slide, we can see how the information is often conveyed in a published systematic review. For the diagram on the right side of the slide, you can see the rows are individual articles denoted by author name and year, and the columns are the different domains that were analyzed. The symbol in each box indicates the result of the analysis: a red dash indicating a high chance of bias, a green plus indicating a low chance of bias, and a yellow question mark indicating that it was unclear, likely due to incomplete information reported by the randomized controlled trials authors. It is not uncommon for there to be a lot of domains being marked as unclear due to inadequate information being shared by authors. On the left side, you can see a domain-by-domain analysis indicating the degree of high, low, and unclear bias across all included articles for that domain. So the obvious question at this point: what if I want to determine risk of bias for something other than a randomized controlled trial? There are different tools for different article types, and some of them are listed here, including the Newcastle-Ottawa scale and the JBI checklist for qualitative research, among others. On this page, we see the Newcastle-Ottawa scale tool, which is a tool used for assessing risk of bias among cohort studies. And here is the CASP tool for evaluating qualitative studies. The results of each of these different tools is reported differently in a published article. So to learn more, I'd recommend looking for existing systematic reviews which make use of your tool of interest. A couple of important notes. As with all prior steps, this step should be performed by 2 or more reviewers to minimize the likelihood of the reviewers themselves introducing bias. Also, the quality assessment and tracking of reviewer inputs can be greatly facilitated by using Covidence, as Covidence has a quality assessment function that can streamline this part of the project. In conclusion, we've covered a range of topics in this session. First, we discussed the definition of risk of bias as it pertains to the quality analysis of articles included for analysis in a systematic review. Then, we looked at some of the different tools which are used to perform that analysis, as well as the way in which the results of that analysis are reported in systematic review manuscripts. Thank you for joining me. Here is my email address, tph@gwu.edu. If you're a student or faculty member at George Washington University, please feel free to contact me with questions. In the next and final session, we will be discussing the issue of writing a manuscript and getting published.